Well, speaking of hot, how about this for a hot topic? We're hearing now from the White House with regard to the health care bill battle, the whole abortion versus economics versus public option. Who better to discuss all these things than Linda Douglas, the communications director for the White House Office of Health Reform. Hello, Linda.
Hey, Dr. Nancy. Thanks for having me.
You bet. So let me just start off with a letter from Congresswomen Diana DeGette and Louise Slaughter that they sent to Nancy Pelosi with regard to the theatrics that happened late Saturday night. And this is regarding, obviously, the Stupak Amendment. They said it represents an unprecedented and unacceptable restriction on a woman's ability to access the full range of reproductive health services to which they are lawfully entitled. We will not vote for a conference report that contains language that restricts a woman's right to choose any further than current law. What is the White House policy and statement?
Well, you know, what's really important here, Dr. Nancy, and I think this is a very important message to communicate to everyone, is working together to find common ground, to strike
Linda, you're not
the right
going to get
balance.
common ground on abortion language. You know that. You and I lived through the 60s and 70s. This is too divisive.
Well, you know, what the president said very clearly yesterday was that this is health insurance reform. This is legislation that is designed to lower costs, to protect you against unfair insurance company practices, to make it possible for you to find health insurance if you move or lose your job. That's what this legislation is about. This is not about changing the status quo. So what the president has said very clearly is that, look, existing policy is that federal dollars should not be used to pay for abortion. At the same time, you do not want to erode the choices, the insurance choices that women have today. So this is about not changing the status quo on the abortion issue. This is about health insurance reform for all Americans.
So the president is against the Stupak Amendment then?
So to that end, we will be working with people such as Representative DeGette, Representative Capps, and others to find some common ground on this issue, to move forward on passing health insurance reform legislation.
What do you want out of the Senate?
Well, certainly we want the Senate to get to the floor with a health insurance reform bill and start working toward passage of the bill, rising to the challenge the way the House did. They are absolutely committed to moving forward. They're simply waiting for some analysis of the financial configuration of their legislation, and they're expecting to start acting very quickly. And, you know, the president still believes that he will have a bill on his desk to sign by the end of the year.
And the CBO is expected to come in with 2 sets of numbers by the end of the week. How are you going to reconcile those between the White House and the Senate?
Well, you know, certainly the House obviously has already passed its legislation. We'll see what the Congressional Budget Office, which analyzes the financial shape of the bill, comes out with. The Senate bills have certainly been bills that show that they are deficit neutral. That is a very firm position that the president has taken. This cannot add to the deficit. This is going to be legislation that is paid for primarily with savings, reducing waste and inefficiency and fraud in public health care spending. So these are conditions that the president has laid down. The Senate bills have already met those conditions, so we're expecting that that is absolutely what the Congressional Budget Office will find. And then we're going to move forward to finally do something we haven't done in 70 years, you know, which is reform the health care system to increase security and stability for Americans.
And, Linda, I know you want a bill on the president's desk tomorrow. When do you realistically expect it?
We expect a bill to be on the president's desk by the end of the year. The Senate is moving with all deliberate speed. Majority Leader Reid is moving his members forward and working through their concerns and questions and issues. And the president believes that they're going to get a bill to him by the end of the year. The American people have been asking their representatives for this kind of help. You know, 1 out of every 2 Americans is going to be at some point without health insurance in the next decade if we do nothing. Their insurance out-of-pocket costs are going to increase 30%. Premiums are going to double again. We can't accept that. So, you know, the country is looking to their leaders to act.
Linda Douglas. Linda, thank you.
Thank you.
Always a pleasure.